It's not often that one gets to talk to the head of a leading international organization, but I got the opportunity to do that just recently when the head of the Pan American Health Organization, Dr. Carissa Etienne, was here in Barbados for a look at some of our healthcare institutions. The Dominican-born Dr. Etienne first talked to me about her background in medicine, but then she also talked about these last 4 years as head of the agency.
Let me thank you for this opportunity to speak to the Caribbean people. I'm from Dominica, and so most of my working years were spent working with the people of Dominica, and I am a Caribbean girl that carries the Caribbean in her heart, you know? And be it globally or regionally. So I have worked not only over the last 4 years at the regional level, but I worked in WHO. I was the Assistant Director General there for Health Systems and Services. And in a way, I brought that experience from Dominica, from working on the ground, and from the global level to the regional level. So in a way, I think I've been very fortunate to work with member states who are extremely committed to health and to the health of their peoples. I have worked with partners who themselves are engaged and committed, and I have a wonderful staff, And over the years, I've learned how to motivate people and how to bring out the best in people. So I think it is together that we've accomplished much of what we've accomplished over the last 4 years. So if you ask me what are some of those accomplishments, I would say that when I came to PAHO, I began the push for universal health coverage and universal access to health. And I was able to get a resolution passed in my end of my first year on the job, where all of the member states of the Americas, including the US and Canada, down to Chile and Argentina and the Caribbean, where they committed to ensuring that all persons had access to health care, comprehensive health care of high quality, and that they would not suffer financial hardships from doing this. And at the same time, the member states recognized the importance of access to the social determinants of health. So that was passed, but it was passed after a year of work with countries to get them motivated, committed, engaged. And since then, we've seen many countries becoming involved. One, they need to look at the organization of the healthcare services. So how to place the emphasis on primary healthcare. And really, my passion is for primary healthcare and universal access. So in a way, we've had the renewal of that primary healthcare effort. But importantly as well, how to connect that with the hospital services to create an integrated network for care. And in hand with that as well is how are they going to finance those healthcare services? Yeah. How are they going to finance that all people have access to care? And so we've been working with them on those financing mechanisms as well. I have increased the cadre of health economists in the organization so we can best respond to that technical cooperation from member states. So I would say that's one of my overarching achievements, but it's something that we need to continue to work at. Then again, in the region of Latin America and the Caribbean, we've seen many emergencies. And we've been able to mount a response that our member states think is equal to none. So we've had both natural disasters and the epidemic infectious diseases. So just with Matthew, for example, we were dealing with a number of countries that had exposure to Matthew. We were able to pre-position our assets in Jamaica, in the Bahamas, in Cuba, and in Haiti. So not only were we able to respond in time, but we were there ahead of time. And so we have a very, very strong emergency program, and we put that at the full disposal of our member states. But as well, we dealt with a volcano in Chile, and in Ecuador with the earthquake, we were there within 24 hours. And we were there providing all the technical cooperation and support to the government and the Ministry of Health of Ecuador. Last year, we had Tropical Storm Erica in Dominica, my homeland.
Yes.
But PAHO was there and with support from the sub-regional emergency program that we have based in Barbados to give full support to Dominica. And so we continue to respond. The year before that, before Dominica, it was the tropical trough in St. Lucia and St. Vincent, and we also responded to that and responded very effectively. But of course, with the infectious diseases, we've seen the emergence of chikungunya. Before that, we had to prepare for the Ebola.
Yes.
And then we saw chikungunya and Zika. And in all of that, we've worked with all of our member states. We mounted 61 missions with varying technical experts to all of our countries to build their capacity, to help them with setting up some of the clinical situations, the internal intensive care units, etc., that they would have to respond. And we worked with universities and researchers from North America, Latin America, to set up the research that is required for Zika, because you know there are so many unanswered questions with Zika. As well, we are leading our member states in looking at the Sustainable Development Agenda and how we need to position ourselves and how the member states need to position themselves to better be able to deliver on this. Important both to the emergencies and to universal health coverage is building the resilient health systems. The whole concept and notion of resilient health systems came out of the Ebola experience in Africa, where those countries had very weak health systems that could not scale up to respond to that level of emergency, and at the same time could not also deliver care, the normal and regular care. So we've helped to develop those resilient health systems. We've helped to build smart hospitals. So we do have a project with the United Kingdom government for some $36 million, whereby we are working in the Caribbean to refurbish hospitals, to make them, to ensure that they can stand up to earthquakes and hurricanes. Because when you have a disaster, you need your hospital and your health centers to be working. So we've done that. And at the same time, we've worked to make them more fuel efficient, so energy efficient. And so their maintenance costs and operational costs also goes down. And then they become greener institutions. So, I mean, there are lots of things that we could talk about that I see, but I think if I say overarching, these are some of them.
Yes. Some of the things that stood out to me were the smart hospitals, certainly. Financing, because that is a major issue, not only here in Barbados, but across the Caribbean countries, maintaining that access, universal access to healthcare. From PAHO's perspective, where you've been trying to drum up the support so that the countries can still, even with burgeoning health bills, are you satisfied with the response from the partners that you're looking at in helping nations like ours?
Well, frankly, yes. I think that the commitment has to be at the level of the member state, because it is the domestic investments that are going to take care of ensuring financing. And so we work with member states to explore various financing mechanisms. Some member states want to go the route of national health insurance. Some of them want to go the route of mixed systems. Some of them continue to say that it is the public sector that must be responsible for meeting the cost of healthcare. Example, Cuba. Cuba continues, and other countries, Ecuador, continue to say that we need to ensure that we develop systems and financing mechanisms that are equitable so that our people can have access to care. But very often they need to know how. and that's what we work with them around. We've been working with them to see how they can also get greater efficiency in healthcare. So pushing a lot of the services to the first level of care, to primary health care, increasing the capacity to solve problems at the first level of care, and so prevent people going to hospitals where it becomes so much more expensive. We've been working with member states in terms of access to medicines and technology. So PAHO has a strategic fund. Many countries of the Caribbean have signed up to the strategic fund. We pull the demand for many of the drugs dealing with chronic diseases, with HIV, AIDS, malaria, and TB, and also supplies, and we tender on those. And we are able to get savings of 100%, 200%, and 4 and 6 times less than countries are buying. We are able to tap into global fund pricing and be able to get those for our member states. I think some member states recognize so much the value of this strategic fund that recently the Mercosur group of countries, they've decided to go into negotiations, but to buy those through the PAHO strategic fund. And whatever prices they negotiate, those prices will be available to every country in the region.
Right.
So that's another way for economies of scale and ensuring that we are able to provide access. And in a way, that's also healthcare financing, because we are becoming more efficient, helping countries to reduce costs.
Right. So it seems like certainly a massive number of things that you could point to and say over the last 4 years, we've achieved this, we've achieved that, and we've passed it on to our constituent states.
Exactly. No, we haven't spoken about our elimination agenda, because I mean that's such a huge achievement. So the region of the Americas, we have a very long history of elimination and eradication of diseases. So we've been able to eliminate smallpox. We were able to eliminate polio. Last year, we had the certification of eliminating rubella and congenital rubella syndrome. This year, we had the announcement that we had eliminated the indigenous transmission of measles from the region. This is huge. This is obviously, it's not only in the last 4 years that we've achieved this. We've built upon many years of ensuring strong immunization programs, ensuring high coverage rates. So in the Caribbean, we have coverage rates for the basic vaccines of 90% or more. And important to note, it is always the region of the sub-region of the Caribbean that has achieved many of those elimination programs. And right now, we are on track for validation as having eliminated mother-to-child transmission of HIV. That too is a big achievement, and certainly we hope by next year we will have the news that we have eliminated mother-to-child transmission in the Caribbean, and we want to do that for the rest of the region. Cuba has already done it, and we want to expand that to the rest of the region.
Oh, that's fantastic. In fact, that took me right into one of my questions because I wanted to know if you thought we were on track to getting there by the target date. So it sounds to me, though, that we're pretty much on track. What else do you think has to be done for us to meet the targets that we need to?
I think the target for mother-to-child transmission of HIV, AIDS, and syphilis has also to be seen within the whole context of elimination and prevention of HIV infections themselves. No? And we just passed a resolution and a plan of action and strategy for doing just that, moving on to the prevention and management of HIV and the elimination of transmission of HIV and STIs. And importantly, we say you need to treat all of your patients. So that means we must have the programs for diagnosing. We have to deal with stigma and discrimination. We have to ensure that the antiretroviral treatment is available for all persons who are infected. that is a tremendous cost because the Caribbean is not having the aid and access to the global funding that we had to deal with HIV and AIDS. So a lot of that must come from domestic sources. But the government of Barbados has made the decision that they will go to treat all of their patients. So we need this, and we need very strong monitoring and surveillance systems. But it is clear that the health sector can't do it alone, so it's how do we work with other partners, with UNICEF, with UNAIDS, etc., so we can mount a program that allows us to reach that goal by 2030 or before. No?
That would be amazing. As we are talking about the elimination agenda, we're going to shift the focus a little bit because the one thing that we're dealing with now in the Caribbean is the Aedes aegypti mosquito, the Zika virus, and all the attendant things that come with it. I think in Barbados, certainly there is a massive push on to eliminate the Aedes aegypti mosquito. In speaking to one of the experts in the field recently, his concern was that in the region we were able to do it early in the 60s, but something happened, they're back with a vengeance, and in some cases even adapting to the conditions now. Where do you think the discrepancy came so that the Aedes aegypti mosquito was able to come back and apparently even stronger?
So, several things. We were digging up on the resolutions, and we found a resolution, a PAHO resolution in 1947, calling for the eradication of the Aedes aegypti mosquito. So we've been at it for a long time.
Yes.
And in fact, yes, in the 50s, 60s, we were able in many countries to eliminate Aedes aegypti mosquito. However, some pockets remained. Some pockets remained, and over time, with relaxation of the Aedes aegypti eradication program, the emergence of resistance to DDT, because that was the insecticide that we used. So resistance to DDT plus resistance to the use of DDT because of its questionable complications. So, so we saw that, and I think as well, it was dealt with primarily as a health issue, but it is more than that. It's multi-sectoral, that we have to get businesses and householders and communities involved in treating. The Aedes aegypti mosquito has emerged as an extremely resilient mosquito. It can survive very difficult situations, drying, arid conditions, and with the first drop of rain, it just hatches, you know, and the eggs hatch, and then we have the larvae and the adult. I think that we will require a multi-pronged approach. We are monitoring the insecticides that are being used for the possible emergence of resistance to those insecticides, but it will take more than that. We have had a vector program in place in PAHO for a long time, and we've had like the strategy for dengue eradication. But with chikungunya and now Zika, the fact that we have yellow fever endemic in some of our countries, and the risk of it becoming urban and spreading to other countries, we have emergence of Oropuchi and Mayaro. So many of them, it is clear that we need to make a concerted effort against the Aedes aegypti mosquito. And we don't know if the current methods that are being used, how effective they are. Obviously, as long as that's what we have, we need to continue. We need to continue to attack the breeding sites. We have to continue to ensure proper garbage disposal. We have to remove every container. And let me tell you, Aedes aegypti can hatch in a bottle stopper, you know, that contains water. So they are very smart, you know. But we need, and importantly, the new technologies that are being developed, we hope that will become and prove to be effective. So the World Health Organization has not approved any of them, but they have said that for one or two of those technologies, they would be willing to partner, but to support it as a pilot program and see what are the results that we get from this. But yeah, we need to do something yesterday.
Oh. Now, staying with Zika, we have the microcephaly. There is the concern about Guillain-Barré. I think we were told there is some Guillain-Barré in Barbados, but there's no link yet to the Zika virus. When we think about it, these are some really serious long-term implications for countries like Barbados with economies that really can't afford to take a hit. How do we deal with issues like that?
Okay, so let's establish some of the facts about Zika. The majority of cases are mild cases, and people don't even know that they've had the Zika virus. But and in fact, it's only retrospectively when we looked at French Polynesia and one or two African countries, they realized that retrospectively that there were neurological complications, but very low. But when it hit Brazil and then Colombia and following that the Caribbean and Central and South America, we began to see increases in the number and rate of Guillain-Barré syndrome. So Guillain-Barré syndrome, however, causes temporary paralysis and temporary loss, but it can be very dangerous because it can affect your respiratory muscles, etc. And some of these patients have to be treated in intensive care for a while. We have to use immunoglobulins, which are quite expensive, and some of the member states in the Caribbean can't afford it, and PAHO, we've been stockpiling and given to them. So that's the Guillain-Barré syndrome. We have told all member states who've reported Zika that you need to have a baseline of Guillain-Barré cases and see if you're not getting an increase. And that's one of the ways that you know that the Guillain-Barré that you're seeing is most probably associated with Zika. And of course, we do the testing for Zika. So that's the first thing. Then the microcephaly that we see, so earlier last year, we went to Brazil, and what it was clear, it was a neurological syndrome. So microcephaly was just at the end of the road, but that it was clear that it was affecting their hearing, their eyesight, that they were becoming very irritable. So so we see now it is a neurological syndrome. For me, that is one of the real problems. We are seeing an increase in microcephaly cases, which has been proven to be caused by Zika.
Right.
But we don't know how to avoid it. We don't have a vaccine.
Yeah.
We have difficulty with reducing the breeding of Aedes aegypti. We are working with countries, particularly to help pregnant mothers to protect themselves. In the meantime that we are doing that, we now know that Zika can be spread by sexual contact.
Yes.
And we didn't know how long, but now we hear as long as 6 months. So it's becoming quite complicated.
Yes.
And it is going to be costly for many of our countries, particularly countries in the Caribbean. A child with microcephaly is going to have many problems, developmental problems, ability to learn in school. That family then has to provide for this child for the rest of its life. So it has complications and implications for various other sectors as well. So we are working with UNFPA, the Family Planning Association, UN, to help with increasing reproductive health services, increasing access to reproductive health services, and particularly targeting adolescents, no? So they don't get pregnant, right? And also we're working with UNICEF for the social support for families that have had a child with microcephaly, but also to help with the community education programs that are necessary.
It's interesting that you mentioned the focus on adolescents and helping them to not get pregnant. There was some, I don't know, suggestions that government should start talking to the females and telling them, you know, now might not be the best time. What are your thoughts on that?
No, we think that we have to be careful because almost the trampling on people's human rights. We can provide information and the education that shows that if you get Zika during the time that you are pregnant, then you can have a child with this neurological syndrome. We can improve access to contraceptive services and other reproductive services. We can increase the psychosocial support during antenatal care and after delivery. But the question is how long you're going to ask people to postpone pregnancy for, because Zika is going to be with us for a while. So after many people have been infected, the infection rate will drop, but then we will see the infection rate go up again when we have sufficient number of susceptibles. So how many years are you going to tell this woman to postpone pregnancy for? This is an individual decision that women and their partners have to take, you know, and their families.
Understandable. Now, in February, PAHO declared Zika an international emergency, and as you said, you put resources in place. Are you satisfied that the resources that you put in place have been taken up and used properly by the countries? What else do you think the individual countries can do to safeguard against Zika?
So in February, WHO declared Zika a public health, an infection of public health concern. And that triggered lots of, but up till now, WHO has not really been able to receive significant resources. We at PAHO, we've mobilized resources. We've had funding from Gates and we had funding from DFID. Recently, we've had funding from USAID. We've had some funding from IDB. And so some like $6.9 million we collected in PAHO. And we've made all of that available to countries, not necessarily in hard cash. So we've done a lot of the capacity building that needs to happen. We have placed money in all of our countries, so our offices there could work with governments to mount the response that was necessary, and much of that has gone into vector control. So countries have spent significant amounts of money of their own on vector control activities. And we think that they're going to have to continue for a while. Obviously, that's detracting resources that should go to NCDs, for instance, and that should go to other conditions. But they have to spend it on vector control because it's politically very important, but more so, I mean, if the lives of these children are at risk, and if they're going to have these malformations and congenital deformities, then we have to do all that is in our power to address this.
I'm glad you walked into the NCDs because I wanted to shift our focus again now a little bit. With all of this concentration on the mosquitoes and Zika, are we losing our focus on the burgeoning problem that are the non-communicable diseases?
No, I don't think so. I think that member states are quite seized about the importance of NCDs. NCDs are the #1 killer. I mean, let's just talk about the Caribbean, for instance. It's the #1 killer in the Caribbean. It's the #1 cause of use of health services. It's the #1 cause of admissions to hospitals. But even more, we see some 40% of those deaths occurring prematurely in people between 30 and 59 years of age. So suffice it to say that the NCDs are also having significant impact in terms of productivity and economics, no? In terms of countries' ability to continue to earn and to continue to invest. They are expensive to treat.
Yes.
The cost of treatment is not low, and it has to be continuous treatment. So over time, it does add up. I think the region of the Caribbean and our heads of states were leaders in NCDs. And it is the Caribbean that brought the NCD agenda to the UN General Assembly, and they got a resolution passed. In 2007, it was the heads of government of the Caribbean that had the declaration, the Port of Spain Declaration, yes, where they laid out the number of things that needed to be done. I think as a region, we probably have not delivered sufficiently on the Port of Spain Declaration. So recently, PAHO partnered with the WI and CAFA to do the evaluation of that Port of Spain Declaration. So the balance is primary prevention. How are we going to prevent people from getting NCDs? And secondary prevention, because those who have those risk factors and those NCDs have to be treated if we don't go on to catastrophic illnesses. And how do we deal with those that already have these catastrophic illnesses? So the renal failure that we are seeing, the heart disease that we are seeing, the amputations that we are seeing, the loss of sight that we are seeing. So we are talking about really very, very difficult conditions. And every person in the Caribbean has had experience with a relative or themselves having had a chronic non-communicable diseases. 1 in every 3 adults here has a chronic disease. What it requires now is a ramping up and a scaling up. We've seen where there's a lot of emphasis being placed on the individual changing behaviors and lifestyles. And we say that's fine, but we say what is more impactful is to create the environments. Create the environments where they can live those healthy lives. So how are we going to increase taxation on the sugary beverages? So let me mention Barbados and Dominica in the Caribbean who've done this. How are we going to remove salts from all of the tables in all of our public eating places? How are we going to have drives on alcohol so we reduce the consumption of alcohol? How are we going to put in place regulations that reduce the advertising of sugary sweet foods, on high fat foods, on high salt foods to our children? Very, very importantly, how are we going to implement the convention, which was binding for many countries when they signed, of legislation against tobacco use? And one of those is the front of package labeling, so where you don't have all of these pretty labels that make people want to go towards tobacco. How do we ban tobacco smoking from public places? Those are not very difficult things to do, and they're not very costly, but many of our member states have not yet done it. And how do we work with the private sector to help them to understand that they have also a civic responsibility to ensure that our people can live healthier lives. How do we increase physical activity at schools? Do you know that in many of our schools in the Caribbean, physical education is stopped after primary school? Really? And even in the upper classes of primary school, there is no physical education again. But how do we make that a way of life? And how do we build cities that encourage people to bike and encourage people to walk? How do we do those things? How do we provide for green, safe places where people can go to exercise? Really, you don't need a gym to exercise. We need to be able to have these green places where people can feel safe and go exercise, like your boardwalk here, you know? Not green, but certainly it's white, but it's a place where people go to exercise.
All right, so Monday was Mental Health Day. One of the things you did while here was tour the psychiatric hospital. What do you think the region needs to do to reduce the stigma that is attached to mental health?
Thank you for that question, because I think if there is a number one issue that we need to tackle is the misunderstanding and the permit me to say ignorance, a lack of information around mental health issues. And it is because we focus on mental illness and not sufficiently on mental health. So this year's slogan dealt with first aid mental health. No? How do we build the awareness of the community, of families towards mental health and mental well-being? How do we support people during stressful periods in their lives? How do we become more aware? So if you're my friend, I can see something is happening. How am I equipped to support you and to open up the subject? And how do we provide access to primary care services for mental health, but also in a way that avoids the stigma and discrimination. Certainly if you have a psychiatrist and I am going to the psychiatrist, the first thing they say, she's mad.
Yes.
But how do we change that mindset? I think at the same time too that governments have to invest. They need to invest in providing for mental health clinics in primary health care, for new categories of workers. So it's not only the psychiatrist, it's also the psychologist, but it's also the social worker who must but how do we also target adolescents? Because that is a group that is very much at risk. I visited your psychiatric hospital here. I must say that we were impressed by the statistics. Your number of admissions is being reduced over time, and it seems that is because of the increasing access to these services within the primary care level, but also the organization of those services, where you have outreach, you have various categories of workers that are contributing to the care of these individuals. However, we also learned that in your acute settings, the primary reason that is associated with mental ill health is the use of psychoactive substances.
Right.
The cocaine and the et cetera, et cetera. No, so that's an issue we have to tackle.
Okay, and then your term at PAHO is, winding down, but I understand that you're up for re-election. So if you were to be re-elected, what would be your focus going forward?
So my current term will end in 31st of January 2018. And I am eligible for a second term, and I certainly do feel that I have the energy and the passion to continue. I feel that my work is unfinished, that I need to continue. And so very often your own passion drives the agenda for the rest of the countries. There are some things that I would like to see. I would like to see us make a significant impact on maternal mortality. In this 21st century, when we know how to prevent deaths of women surrounding labor, etc., we shouldn't have women dying from these preventable causes. And so I've already begun a major initiative towards this. I'm employing 10 new people to put these people in the countries with the highest maternal mortality rates. Maternal mortality is very much linked and associated with inequity and also with poor health systems and health services. So that I would like to see, and I would like to see it happen quickly too. I want to see us build on the universal access to care and universal health coverage. Every man, woman, and child must have access to the services that they need. And this is not only curative services, it's preventive, it's promotive, it's rehabilitative. We cannot call ourselves a modern society if people have to die because they can't afford to get to care. I mean, this is unacceptable. So I would like to see that too. In my region, very often, particularly in the Caribbean, we are saying we need information systems. We need information systems for health. We need systems that can support patient care and electronic patient records, but it goes beyond this. We need to be able to monitor, we need to be able to report on those infectious diseases, we have to be able to diagnose what they are and we have to be able to collect the kind of information that the policymakers require to make quick, easy decisions, no? And at the moment, we don't have that. So I am starting in November. I will have a meeting with the Caribbean so we can begin to look at what is your vision for information systems for health and how can we work. And I've already begun to speak to some donors because we need to achieve that. It is the desire of many of our member states here. We have to be able to break the back of NCDs, because if we don't, our people's lives are in jeopardy. The people are dying, younger and younger people are dying. So we need to do something. We need to do something about this. And of course, we need to continue on our elimination agenda. We have to eliminate malaria from this entire region. It's not in the Caribbean, but it's in other parts of the region. We have to eliminate the neglected infectious diseases. We have HIV on our radar, and we need to ensure that all of our public health programs are the very best. This region, I dare say, is the best region in all of the world. We achieve much more than any other WHO region, and we have to maintain that positioning and that leadership that allows us to be able to deliver for our own people, but to deliver at a global level, that we are able to be leaders in the public health field. So, of course, this is my passion and my vision.
And we can see how passionate you are, which brings us then to my final question. I know that we've been talking for a while, but I think that passion, the drive, and the achievement certainly that you've had over the time at the head of PAHO have pretty much put you in the eye of the University of the West Indies.
Chancellor, I present Dominican-born Dr. Carissa Etienne, a distinguished graduate of the University of the West Indies. I take great pleasure in asking you now, by the authority vested in you by the Senate and Council of the University of the West Indies, to confer on Dr. Carissa Etienne the degree of Doctor of Science honoris causa.
Dr. Carissa Etienne, by the authority vested in me by the Senate and Council of the University of the West Indies, I have pleasure in conferring on you the degree of Doctor of Science honoris causa of the University of the West Indies. My sincere congratulations.
I am really very proud of this, and I'm humbled as well. And yeah, I continue to be that Caribbean person, and I'm very happy.
Dr. Etienne, thank you so much for sitting down with us, and I do wish you all the best. Thank you as you go forward.
Thank you very much, and thanks again for the opportunity.
Certainly.